Welcome back to Advanced Concepts. We're going to spend some time talking about anatomy and physiology behind mobility. The musculoskeletal system is the second largest body system. It's going to include bones, joints, skeletal muscles, and then any supporting structures that are required for movement. And remember that mobility is a basic human need. It's essential to perform all activities of daily living. So when you're doing your assessments, always remember to consider your patient's activities of daily living and how they're able to perform and carry out those activities of daily living. When mobility is impaired for a long time, other body systems are also going to be affected. So prolonged immobility could lead to skin breakdown, constipation, blood clot formation. So lots of different things to think about when we are considering that. So when we talk about the musculoskeletal system, we need to consider the different types of bones. So the different types of bones, long bones are going to be things like your femur. They are cylindric shaped with round ends and often bear weight. The short bones, such as your phalanges, are small and bear little or no weight. Flat bones are going to be things like your skull, your scapula. They provide protection of vital organs and often contain blood-forming cells. Bones that have unique shapes are irregular bones. So you could think of those about like your carpal tunnel bones, or carpal bones, your wrists, small bones of the inner ear. Those are going to be things that are irregular. And the sesamoid bone is the least common type and develops within a tendon. So the patella is going to be one of those sesamoid bones. The second way a bone is classified is by its structure or composition. So when you're looking, you can look at figure 51-2 that was on the first slide, and it talks about the outer layer of the bone being the cortex, which is composed of dense, compact, bony tissue. The inner layer is the medulla, and that contains spongy tissue, and almost every bone has both types of tissues but in varying amounts. The long bone typically has a shaft or diaphysis and two knob-like ends on the epiphyses. The structural unit of the cortical compact bone is the Havre-Sagen system, which is also delineated out in figure 52-1. The softer cancellous tissue contains large spaces or tuberculae, which are filled with red and yellow marrow. So hematopoiesis is the production of red blood cells, which occurs inside the red bone marrow, and the yellow marrow is fat-containing cells, and if those would become dislodged and enter the bloodstream, it would cause a fat embolism. So those fat embolisms are really more common with fracture of large bones or hip fractures. So we do need to kind of be aware of where those fat embolisms are going to be coming from. Osteoblasts are bone-forming cells, and then your osteoclasts are bone-destroying cells, and those are going to be important. Those are the deepest layers of the periosteum, or the outermost covering of the bone. The bone also contains a matrix or osteoid consisting of collagen and some polysaccharides and lipids. There's also inorganic calcium salts that help provide the bone with its strength. The bone is a very vascular tissue, and so when you think about fractures and things like that, we need to remember that we can have quite a bit of blood loss with fractures. The function of the skeletal system then lastly provides a framework for the body, allows the body to bear weight and be upright, helps support surrounding tissues, assist in movement through muscle attachment and joint formation. Again, it provides protection to vital organs, it manufactures blood cells in the red bone marrow, and then provides a place for storage for calcium and phosphorus. After puberty, bone reaches its maturation and maximum growth. Otherwise, bones continue to undergo resorption or destruction and formation at an equal rate. When you think about joints, joints is a space between two or more bones that come together. There are three types of joints in the body. There are immovable joints, such as in your cranium. There are slightly movable joints, such as in your pelvis, and then freely movable joints, like in your elbows and knees. The synovial joints are the only type are the only type lined with synovium, and that membrane secretes a synovial fluid that is good for lubrication and shock absorption. And this is shown in figure 52-2 when it talks about the structure of a synovial joint. Bursae then are small sacs lined with that line the synovial membrane and are located at joints and bony prominences, and that helps to prevent friction between bone and adjacent bones or structures that are next to it. If those become inflamed, then you end up with what's called bursitis, which can be kind of painful. When you think about the muscular system and the muscles, there's three types of muscles in the body: smooth, cardiac, and skeletal. Smooth are responsible for involuntary muscle movement. It's also responsible for contractions of organs and blood vessels, and it's controlled by the autonomic nervous system. Cardiac muscles are involuntary muscle and is also controlled by the autonomic nervous system. And the smooth and cardiac muscles are discussed within the body systems to which they belong. So if you want to read more in depth about specific muscle types, then refer back to your book that way. We need to consider the supporting structures for the muscular system. Though they're going to be very susceptible to injury, so thinking about your ligaments and tendons. And so tendons are bands of tough fibrinous tissue that attach muscle to bone, and ligaments are attach bones to other bones at joints. When you think about changes, you do need to consider age-related changes within the musculoskeletal system. Osteopenia is going to be a term that you need to be familiar with. If you look on chart 52-2, it looks at musculoskeletal assessment using Gordon's functional health patterns, and it talks about activities of daily living and cognitive and perceptual patterns associated with the skeletal system. When you are considering different types of patient history, family history, genetic risks, nutritional history, things you need to think about with the assessment of a patient with an actual or potential problem. You need to consider accidents, illnesses, lifestyles. Are there any drugs that might be contributing to problems? Any prior traumas from a motor vehicle crash? Questions about any other sports injuries, because a lot of times you don't really think about sports injuries. Any injury to the lumbar spine that might now be creeping up and causing pain later in life. So lots of different things to think about when you are considering that musculoskeletal system history. And then you will go through and do your assessment, and this will be discussed more in depth in class and will come out of chapter 52 of your Ignatius and Workman book.